Greetings from Human Biological Institute. Welcome to yet another engaging session forum Immunize Talks. At Human Biological Institute, we take pride in driving self-awareness initiatives through our one-of-a-kind platform, Immunization, dedicated to educating public about vaccine-preventable diseases and the importance of timely vaccination. This session focus on key health topics aim to raise awareness and promote well-being of the society. Today, his why it's essential. I shall be sharing more about today's speaker in a short while, but for the moment, please allow me to share a brief introduction. Human Biological Institute is a division of Indian Immunologicals Limited, which is a One Health company. IIL was established by the National Dairy Development Board in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. HBI was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out the first cell culture rabies vaccine in the year 2000. Subsequently, HBI launched other vaccines and currently HBI is a major player in human vaccine segment. HBI is a leader in anti-rabies vaccine segment with a presence in around 60 countries with 3 state-of-the-art manufacturing facilities which is at Ooty, Gachibowli and Karakapatla. With a vision of shaping global healthcare by spearheading One Health initiative with a mission to innovate, produce and market quality healthcare products and services to improve and extend life, HBI believe in providing affordable products with high quality through continuous technological innovations and improvements to meet our customer needs. Some of the corporate social responsibility projects of Indian Immunologicals Limited, IIL has adopted 2 government schools in the vicinity of Karakapatla facility at Hyderabad, which is in Telangana. It is IIL is providing infrastructures and basic facility, including help in the midday meal scheme program. In coordination with National Dairy Development Board, with the help of Gift Milk Program, over 2,500 school-going children from Telangana and Tamil Nadu are being benefited. As IIL has also donated oxygen generation plant to Telangana Institute of Medical Sciences at Gachibowli. So these are the key highlights of Indian Immunologicals Limited and Human Biological Institute. To know more, please visit www.indimmune.com and follow us on the social media site. Image with Pride is one of a unique initiative which emphasizes that vaccination not only protects individuals but also strengthens community immunity. Welcome to today's episode of Immunization Conclave. This session is dedicated to a high significant topic, that is childhood, why it is essential. It is my privilege to introduce our guest speaker today, Dr. Anirudh Gupta, who is a leading gastroenterologist. It is my pleasure to introduce Dr. Gupta as a highly accomplished gastroenterologist and hepatologist, known for his clinical excellence, academic contributions, and patient-centered approach. He completed his MD in internal medicine as a gold medalist, qualified MRCP UK, and pursued in gastroenterology from SMS Medical College, Jaipur, building a strong national and international academic foundation. His current He has also published research in research papers in journals such as Pancreatology and continues to contribute actively to advancing gastrointestinal and liver care. Welcome, Dr. Gupta. It is truly a privilege to have you with you to the session. Yes.
Thank you so much.
Yes, Dr. Anirudh. So, Doctor, as you know, topic of discussion is vaccination beyond childhood. It's essential. So, the common notion among the people that will associate vaccines only with child. So, why should adults understand in a context? Why it is relevant according to you?
Yes, good morning to all our listeners. So, I know it is a very relevant topic in today's world, which we are discussing today, that is adult immunization. So, what we should know is that adult immunization is not optional. It is a continuum of protection because the immunity from the childhood vaccine, it actually wanes over time. And adults may face new risks due to aging, due to certain comorbidities, and due to their lifestyle or travel. So, from a gastroenterology perspective, I would like to emphasize that certain chronic diseases, such as fatty liver, cirrhosis, and even patients with diabetes, they have an increased risk of infections. That the immune response it declines with age. We call it as the term immunosenescence, which means that the immunity declines with
Yes.
age. And the exposure risk that increases through travel, hospital visits, and the dietary habits. So vaccination, it helps to prevent all these things. It helps to prevent serious infection. It reduces mortality in high-risk patients, and it protects the organ function.
Okay. So, Doctor, am I audible to you?
Yeah, 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 yeah.
So,
Yes.
as you said, immunosenescence. Could you please explain how? Because normally, when a child is born, there will be some immunity from the mother. Then the child is given vaccines. For how many years? Certain vaccines must be have a certain year of protection. And what is this immunosenescence? Actually, please could you please explain it better?
Yes. So
Yeah, am I audible?
immunosenescence, it means that how, yeah, as a patient ages, as a person ages, its immunity declines slowly. And most of the vaccines that we
Okay.
get, as per the immunization program in pediatrics, they're usually up till the age of 5 years mostly. So by the time a person reaches to adult life, that is 18 to 20
Okay.
years, most of them tend to decline. So adult vaccination is really important so that we can continue having that immunity throughout our life. Throughout our life. So it is very important to increase awareness on adult vaccination and also to also tell our patients to get immunized on time so that certain diseases can be prevented instead of treating them. So you are not audible.
So, doctor, certain vaccines, as you know, are important for people like who are suffering for associated liver diseases, fatty liver diseases, chronic liver diseases, or cirrhosis. So, according to you, which are the diseases or which vaccines these patients who are having this kind of conditions should definitely consider?
Yes. So, especially in patients who are suffering from fatty liver disease or maybe cirrhosis of liver, they can lead to decompensation of the liver. That is, it can cause jaundice or even complications such as ascites. So, we should look for key vaccinations such as hepatitis A vaccine, hepatitis B vaccine, pneumococcal vaccines, influenza vaccines, even tetanus, diphtheria, pertussis vaccine, And the new one which we these days tell our patients is the shingles or the herpes zoster vaccine. So these vaccines are important in patients having these comorbidities, especially.
Okay. So, as you said, there is certain called hepatitis A vaccine. Why should adult think hepatitis A vaccination, particularly for those who are having liver disease or people those who travel?
Yes, so it's a very important question, and hepatitis A is the in thing these days because of our lifestyle that we are having, and especially people who are tend to having too much of food outside in not very hygienic conditions. Hepatitis A is very prevalent. So hepatitis A usually and classically has been a very mild disease in healthy individuals, but especially in patients having a chronic liver disease or any sort of disease which is decreasing immunity, such as diabetes, it can be fatal. It can lead to jaundice. It can lead to liver decompensation that can be harmful to life. So the high risk groups include patients having NAFLD, fatty liver diseases, hepatitis B, hepatitis C, who are frequent travelers, who are doing frequent outside food consumption, or those who have poor sanitation exposure. So, in these patients, it can lead to acute liver failure. It can also precipitate acute and chronic liver failure, which we call ACLF. And it is entirely preventable with two doses. That is the most important point. If we vaccinate the patient with hepatitis A, it can prevent this altogether. So, in especially in a place like India, where the incidence is quite high, I would say hepatitis A vaccination should be recommended to all patients and even a few healthy people who are at high risk for this.
Right. Doctor, you said, do you feel that there is a change in epidemiology in India and hepatitis A is getting severe? Because in the past 1 decade, we observe a lot many outbreaks are happening in India. So, what is your point on this?
Yes, you are right. Like in my 3 years in DM, at least I saw over 30 patients, young patients, within 20 to 40 years
Oh,
of age group, having full liver failure, means who had to go for a liver transplant, and some of them even died just with an hepatitis A infection. This is the reason I got myself vaccinated with hepatitis A last year, because I was also scared seeing those patients. Means
oh.
I
So,
would say if it's preventable, it is better we go for prevention rather than look for treatment, because once liver
yes,
failure is there, treatment options are very limited.
true. And it is getting very severe. People are getting admitted. I think it is for hospitalized for 15 days. And as you said, it is one of the major cause for acute liver failure in India. I mean, as you said,
Yes.
it may lead to death also. Now,
Yes.
doctor, any other disease like which is very critical, which for which vaccination is important? As you say, now there is a lot of talk about pneumococcal vaccine. So, what is your say for the adults with diabetes and chronic illness? Do they require a pneumococcal vaccine, and why it is important?
Yes, so this is also a very important question, because pneumococcal disease, it can lead to severe complications such as pneumonia, such as sepsis, or even meningitis. So,
Yeah.
especially in patients with the diabetes or having liver cirrhosis, patients having chronic kidney disease, or patients who are on immunosuppression for any long-term illness or on long-term steroids, these patients are particularly susceptible to pneumococcus, because they are having high infection rates, they are having more severe disease, and there is higher chances of mortality. So in these patients, vaccination, it may help reduce hospital admissions, it prevents having any invasive disease, and it is more critical for cirrhotics who are prone to infections. So I would say pneumococcal vaccine, especially in the high risk group, is really important.
Um, uh, right, doctor. So, if you see um, uh, adults, certain disease which are actually, if you see enteric diseases, certain disease which are also apart from hepatitis A, there are certain diseases which are also food and waterborne, like typhoid. So, do you feel yes, typhoid is also very important for the people who are being affected with or liver or gastro related concerns?
Yes. So typhoid fever, as we know, is very common in India. Still, it is very relevant, and people who are especially similar kind of profile with hepatitis A, patients who eat frequently outside, who are travelers, who are healthcare workers, and patients who have liver diseases. So for these patients, food and water contamination is common, and typhoid it can have a very serious infection. It can cause sepsis, it can worsen liver function, and it can also mimic hepatitis. So in these patients, prevention is better than cure. So I would say if we take typhoid vaccine, especially to this high risk groups, we can prevent having a severe typhoid infection, especially. So having an enteric fever, which can cause systemic complications, the incidence is vastly reduced if we vaccinate ourselves.
Okay. So, doctor, you now discuss something about the preventive health, vaccination, and all. So, in practice, what are the challenges you face in convincing the people who actually come with the such kind of diseases? Because in India, if you see, it's mostly people think that it is in practice that once we give the child a vaccine, then we forget that we don't take vaccine during adolescent unless the disease is very concerning, or unless like something like COVID has come up, people got all of a sudden got aware that we should take vaccine, or swine flu is there, then people get concerned, or dengue is coming, so the mortality is very high. That's why people get concerned about vaccination. So, what kind of challenges you face, and how we can overcome these challenges of vaccination exclusively when for your people like who are actually having liver issues or gastro issues?
Yes, so you are right. It is a tough job to convince my patients and even other people to get vaccinated, because the concept we have is only treat once it's there. Means people
Yes.
do not means if it's working, if it's okay, they don't want to touch it. I know it is a right philosophy, especially in a few cases such as in geriatric medicine, but for the young population or patients having chronic disease, we have to emphasize on the concept of prevention is better than cure. We have to
Yes.
educate the people. We have to tell patients that if we get this disease, the magnitude of the disease that we will be getting is much greater than even if we have some kind of a febrile reaction or a small side effect of the vaccine, or if we do get, that is much lesser than the kind of disease we are preventing with it. So we need to have more such sessions, educating the people, especially the patients, and trying to convince them that vaccination is a very small step which can help prevent a very big disease in the future. But it's
Yes.
more of a mindset thing, and also lack of education. So if we are able to bridge that gap, I am sure like people are getting their children vaccinated now, so they'll understand the importance in adult vaccination as well.
When we go for a child, normally child goes to the pediatrician. We have a definite schedule of vaccination for the child, where parents used to go and check these vaccines are important year wise and all. But something, if we see in adults or exclusively for a specialty care, we don't have anything such which takes care of, like tick mark the vaccines, or which needs to be seen that whether these vaccines have been given and the patient is protected. So, do you feel that this is also very important in the practice that we bring in this kind of vaccination schedules for adults, adolescents, and certain high risk groups?
Yes, I think we can introduce these schedules. They should be tailored according to the patient. They can't be
Yes.
fixed because it depends on the kind of disease the patient has, the comorbidities. But we should be having a framework which helps guide the clinicians so that they are also better educated. We can edit the schedule a bit according to the patient, but we should have some kind of set guideline or framework which we can look forward to it, so that it's easier to remember and easier to prescribe, even to tell the patient. I do agree, because especially in patients who are we are giving long term immunosuppressants, like for
Yes.
patients with inflammatory bowel disease, we are giving immunosuppressant for 10 years. So there it's very important so that the patient is vaccinated before we start immunosuppressants. So every clinician has a framework of what to give, how to give, and when to give, that would make the compliance to immunization greater.
So, doctor, now you told something about people on immunosuppressants. So, what precautions should people be taking who are on steroids or immunosuppressive medicines? Um, what precaution they should take, and what they should know more about vaccination?
So the most important thing is that the timing of vaccination in such a case.
Okay.
If a patient has already been diagnosed in a primary care center and he has been started off steroids there, then it's difficult for us to introduce vaccination once he reaches the tertiary care center. So this concept of vaccination should reach the grassroots level, so that whenever the patient is diagnosed with a disease and is planned for immunosuppression, we start vaccination right from there, because we can't wait for the vaccine to act to make antibodies before we start immunosuppression. So if at these we go for a pneumococcal vaccine very commonly, so we start with pneumococcal vaccine the day the patient is diagnosed. So we try to introduce these vaccines as early as possible in the treatment, rather than leaving it for a later time when he reaches a bigger center. So, like you told, this framework or this schedule. So I think this would be very helpful to guide more physicians before the patient reaches to a specialist care.
Now, doctor, before entering two more questions, we'll be discussing. We discussed people who are traveling, people who are on risk for liver cirrhosis. There's something called many diabetic patients are. India is a diabetic capital, I would say. Then many diabetic patients may not realize the infections can lead to more severe outcomes. So, how do you see that vaccines help in reducing these complications? Obviously vaccinations won't help them in reducing their sugar level,
Yes,
but how they can this getting the complications from other diseases.
yes, I do understand your question. It's a very important question because we have a high load of diabetes across the
Yes.
country. See, it's important to understand that diabetes is an immunocompromised state. There's
Yes.
decreased neutrophil function, there's poor infection control, and even if there's an infection, it can lead to a delayed recovery. So, what is most important to understand that infections in such patients can be more severe. They are at higher risk of pneumonia, sepsis, and even infections like TB. So, what vaccines can do is they can reduce the complications. They can also prevent glycemic deterioration during infections. So, if a patient has a severe infection, sometimes the sugar control goes haywire, and that can increase infections again. So, that becomes a cycle which is very difficult to break. So, if you are able to prevent infection in the first place, that is very helpful for the long term health of the patient. And it can also lower the mortality risk. So I would say infection prevention is really important for better diabetes control. And if a patient is diabetic, is in the high risk group, he should definitely go for immunization.
Yes. So that was very clear. Thank you, doctor, for this. And once last question we'd like to discuss, or we want to have your message to the viewers who are with us today. What should adults, especially those with diabetes and liver disease and other high risk conditions, know about protecting themselves against hepatitis, that is both A and B vaccination, as an immunization beyond childhood? Because we have seen many people are not been vaccinated against hepatitis B and also hepatitis A because this vaccine was not available to a large number
Yeah.
of population. Yeah.
So as per hepatology, hepatitis A and hepatitis B, they are the cornerstones of adult immunization. So they are very critical because they both affect the liver directly, and especially co-infection, it tends to worsen the outcome. And they are preventive causes of cirrhosis and liver cancer. So, especially in a group of patients, like patients having diabetes, patients with fatty liver, as you know, majority of the population today, especially patients who are overweight or obese, are having fatty liver. So, patients with fatty liver, patients having alcohol-related liver diseases, and also healthcare workers and family contacts. This is a population that is really important to have up to date hepatitis A and hepatitis B vaccination. And yeah, as a healthcare worker as well, I would say it's very important to have both these vaccinations up to date. And if these vaccinations are up to date, the efficacy of these vaccines is so high, and the complication rate is so less, I would say you can almost forget about having hepatitis A and hepatitis B after you get. And these can protect the liver from viral injury and also can prevent long term complications. So hepatitis A and hepatitis B, from a hepatology perspective, are actually really important. So I am also telling all my colleagues, all my staff to get latest up to date vaccinations for both of them. That is really important.
Yeah. So thank you, doctor, for your time, and have a very nice discussion we had today, which is vaccination beyond childhood. And you have taken us through the life course vaccination of various important vaccinations we have discussed. That is hepatitis A, hepatitis B, typhoid, pneumococcal, and one more vaccination also, influenza shot, is very essential for these days. So these are the clear-cut adult vaccinations. Thank you so much here for doctor for your time and sharing your thoughts for today, all the viewers. So with this, we are extremely thankful to Dr. Anirudh Gupta for sharing his valuable thoughts on the today's topic, vaccination beyond childhood. And to know more or see if people who have missed the video, they can go and check the social media channel. It is be live there. So thank you. Till then, do good care of yourself. Till then, goodbye. Thank you, doctor.
Goodbye. Thank you.
Thank you.